Acrivastine. Acrivastine is an antihistamine medicine that helps the symptoms of allergic. It's used to treat hay fever, conjunctivitis, eczema, and hives. It's also used for reaction to insect bite and sting and for some food allergic. Acrivastine is known as a non-rosy antihistamine. It's less likely to make you feel sleepy than some other antihistamines. Acrivastine is available on prescription. You can also buy it from pharmacies and supermarkets. It comes as capsules. Sometimes it's combined with a degancest called pseudoprediene to unblock your nose and sinus. It's usual to take acrivastine as you need it up to 3 times a day. Acrivastine is classed as non-rosy antihistamine, but some people still find it makes them feel quite sleepy. Common side effects include the dry mouth and dizziness. Do not drink grapefruit juice while you are taking acrivastine. It might make you more likely to get side effects. It's better not to drink alcohol while you are taking acrivastine as it can make you feel sleepy. When acrivastine is mixed with pseudoprediene, it's called Benadryl allergic relief plus decongestant. Some Benadryl products do not contain acrivastine but a different antihistamine such as cetirizine. Who can and cannot take acrivastine? Acrivastine capsule that you buy from pharmacies and supermarket can be taken by adults under the age of 65 and children aged 12 years and over. Acrivastine is not recommended for people over 65 because very little research on the medicine has been done in this age group. Talk to your pharmacist or doctor if you over 65 and want to take acrivastine. Acrivastine is not suitable for some people. To make sure it's safe for you, tell your doctor or pharmacist if you have ever had an allergic reaction to acrivastine or any other medicine, have kidney disease, have epilepsy, or another health problem that puts you at risk of seizures or fits, have a rare illness called propridia, and you to have an allergy test. Taking acrivastine may affect the results, so you might need to stop taking it a few days before the test. How and when to take acrivastine? If you or your child have been prescribed acrivastine, follow your doctor's instruction about how and when to take it. If you bought acrivastine from a pharmacy or shop, follow the instructions that come with the packet. Dosage. Acrivastine comes as capsule 8 mg. The usual dose in adult and children age 12 age and over is 1 capsule 3 times a day. When it's mixed with the decongestant, each capsule contains 8 mg of acrivastine and 60 mg of pseudoprediene. The usual dose in adult and children age 12 and over is 1 capsule 3 times a day. Do not take more than 3 acrivastine capsules or 3 acrivastine mixed with pseudoprediene capsule in 24 hours. How to take it? Acrivastine does not usually upset your stomach. You can take it with or without food. Swallow the capsule whole. Do not chew them. Always take acrivastine capsule with a drink of water, milk or juice. But do not drink grapefruit juice with acrivastine as you may be more likely to get side effect. When to take it? You may only need to take acrivastine on a day you have symptoms such as when you've been near to something you are allergic to like animal hair. Or you may need to take it regularly to prevent symptoms such as to stop hay fever during spring and summer. What if I forget to take it? Take your forgotten dose as soon as you remember unless it's nearly time for your next dose. In this case, Skip the missed dose and take your next dose at the usual time. Do not take 2 doses to make up for a forgotten dose. Do not take more than 3 capsules in 24 hours. If you often forget dose, it may help to set an alarm to remind you. You could also ask your pharmacist for advice on other ways to help you remember to take your medicine. What if I take too much? Acrivastine is generally very safe. Taking more than your prescribed dose is unlikely to harm you. If you take an extra dose, you might get some of the common side effects. If this happens or you are concerned, contact your doctor. Side effect. Like all medicine, acrivastine can cause side effect all throughout. Not everyone gets them. Common side effect. There are some difference between the side effect of medicine that only contain acrivastine and medicine that combine acrivastine with pseudoephedrine. The most common side effect of acrivastine is feeling sleepy and tired. This happens in more than 1 in 10 people. Other common side effects of acrivastine happen in more than 1 in 100 people. These include dry mouth, freezing dizzy. Talk to your doctor or pharmacist if these side effects bother you or do not go away. The recommended side effect of acrivastine when mixed with pseudoephedrine happen in more than 1 in 100 people. They include difficulty sleeping, feeling sick, nausea, headache, feeling nervous, difficulty peeing, especially those with an enlarged prostate. If you experience any of these, stop taking it and talk to a doctor or pharmacist about trying an acrivastine only medicine. Serious side effect. Call a doctor straight away if you start seeing things that are not there. You get a rash. You get pain or discomfort in the chest, neck, back, or shoulders. These could be signs of angina or heart attack. Your skin gets more red than usual, or you get small pus-filled blister on the skin. These could be signs of a condition called acute generalized exanthematous pustulosis. This usually happens within the first 2 days of treatment. You get sudden stomach pain or start bleeding from your bottom, rectal bleeding. You suddenly cannot see properly. Serious allergic reaction. Serious allergic reaction. In rare case, it's possible to have a serious allergic reaction. Anaphylaxis to acrivastine. These are not all the side effects of acrivastine. For a full list, see the leaflet inside your medicine packet. How to cope with side effect of acrivastine. What to do about feeling sleepy. Try a different non-drowsy antihistamine. If this does not help, talk to a doctor. Talk to your doctor. Dry mouth. Chew sugar-free gum or suck sugar-free sweet. Feeling dizzy. Lie down until the dizziness passes, then get up slowly. Move slowly and carefully. It's best to avoid coffee, cigarette, alcohol, and recreational drug. If the dizziness does not get better within a couple of days, speak to your pharmacist or doctor. Pregnancy and breastfeeding. Acrivastine and pregnancy. Acrivastine is not usually recommended during pregnancy because there is very little information about its use in pregnancy. Other antihistamine that we know more about may be more suitable. If you think you need to take acrivastine in pregnancy, talk to your doctor or pharmacist. They will be able to help you decide or may suggest other medicine for you. Acrivastine and breastfeeding. If your doctor or health visitor says your baby is healthy, you can use acrivastine while breastfeeding, but it is better to take occasional dose, so only for a short time. We do not know how much acrivastine gets into breast milk, so it is better to take an antihistamine, which we will know more about. If you are breastfeeding or planning to breastfeeding, talk to your doctor. They may prescribe similar antihistamine called clotrimine or cetirizine that are more suitable while you are breastfeeding. Talk to your doctor, pharmacist, midwife, or health visitor if your baby is not feeding as well as usual, seems unusual sleepy, seems irritable, or if you have any other concern about your baby. Caution with other medicine. Some medicine affect how acrivastine works, so can increase the chance of your having side effect. Check with your pharmacist or doctors if you are taking ketoconazole, a medicine to treat fungal infection, erythromycin, an antibiotic, and medicine that makes you sleepy, gives you a dry mouth, or makes it difficult for your pee. Taking acrivastine might make these side effects worse. Acrivastine mixed with pseudoperidine affect lots of medicine. Check with your pharmacist or doctor before you take it. Mixing acrivastine with herbal remedies and supplement. There might be a problem taking some herbal remedies and supplement alongside acrivastine, especially ones that cause sleepiness, a dry mouth, or make it difficult to pee.